Okay, so we're now going to talk about chemotherapy. Chemotherapy has a lot of adverse effects. It disrupts it disrupts the cell cycle in different phases. It stops replication and cell metabolism. Some work through the entire cycle, others are more specific. You're not responsible for that. It is used usually in combination therapy and combination of other drugs, and it may be given in cycles. Okay? The adverse effects of chemotherapy are on pages 395 through 401. You're not responsible for all of that. You just need to know basically what chemotherapy is and how it works. And it works by disrupting the cell cycle in different phases and stopping replication and cell metabolism. What I want you to know about administration of chemotherapy is that it requires a nurse that has completed an approved chemotherapy program and has demonstrated competency in administering chemotherapy. Alrighty, that the safety for the nurse is that the nurse needs to have on a mask, gloves, gown. The PPE is according to hospital policy, but that's generally it. And it's not just regular gloves; they're called chemo gloves, and they're a thicker type of glove that the nurse wears. Okay. When the IV is the preferred route for most chemotherapy agents, there are some oral agents for chemotherapy that are given long term. You need special training, but it's not an advanced practice need. But there are, like I said, you have to be certified in chemotherapy agents in order to give chemotherapy agents. Do look at exacerbation of the vein there in 392. This is one of the reasons that chemotherapy is rarely given through a peripheral line. It's generally given through either a portacath or a PICC or a central line, some type of central accessed IV, so that the chemotherapy doesn't eviscerate the skin. Okay. So moving on to administration of chemotherapy, we talked about that they generally put that through a vascular access port, like a PICC or a Hickman or a Grashon. There's all kinds of different types of ports. You can see here where this has exacerbated through the skin, and it actually will kill tissue. There's a picture in the book where it's actually already sloughing off, and so that's the reason that it's so vital that we make sure that these central access points have good blood return prior to giving their chemotherapy. Okay. Chemotherapy, patient-centered nursing care. This is the part that I want you to know, not the individual, what the different chemotherapy agents are. If you go into oncology nursing and become a chemotherapy certified nurse, you will learn all of that. That is not what is important. But this patient-centered nursing care is important. I want you to look at the infection risks in chart 22-4. It talks about the neutropenia again in 22-3. Make sure you look at the action alert on page 396. Most of this we've talked about it in different for different circumstances. Chemotherapy induced nausea and vomiting. So please know chart 22-7. There's just really no reason for me to go over all this with you. It's very well put into your book. As you can tell, I've asterisked these charts. I've put the page numbers. They are important. The book does a very great job with these charts, and they are important. Okay, so I would like to make sure that you know that you need to look at these charts for the patient-centered care of patients receiving chemotherapy. All right. Other forms of cancer treatment can be immunotherapy for biological response modifiers. There are monoclonal antibodies. There is small molecular inhibitor target therapy. There's a drug alert on page 404 that it's all you need to know for the exam about all of these. Just know that there are other treatment forms for cancer, but the small molecular inhibitor, this is one of those where they take it long-term at home. It's given a lot of times for advanced breast cancers, but it's important that the patient who's on this, they sometimes do not realize the importance of keeping up with this medication and how to treat it, because they see it as just a pill, but it's very important that only the patient touches the pill and how it's given. So make sure you look at the drug alert on page 404, and that's really all you need to know, other than that there are other treatments other than chemotherapy and radiation. And just know that with the small molecule inhibitor target therapy, that there's special modifications that patients have to take care of when taking these drugs. And sometimes we have to make sure that they are well educated on that, because they don't realize or they forget the importance of therapy and the safety for that therapy. Oncological emergencies include acute complications from cancer and or the treatment of cancer. Can occur at any time. You don't need to know all of these, just know that they exist. Patients, because of their immunosuppression, can have sepsis. They can have a syndrome of inappropriate antidiuretic hormones. They can have spinal compression from tumor. They can have hyperkalemia. They can have cerebral vena cava syndrome, which is that buildup of pressure. They can have tumor lysis syndrome as well. You don't need to know these in depth. I would make sure that you're aware that it's because of their immunosuppression that they can have sepsis. So the ones I would like you to kind of spend just a little bit more time with, that I may ask just enough of a question so you know what it is. Know what cerebral vena cava syndrome is. It's that buildup of the pressure. Make sure that you do read that small section so that you're able to answer a very brief question on cerebral vena cava syndrome. And just, we've already talked about sepsis a little bit. You'll cover it more in 495. Big thing is just to know that the reason that these patients get septic is because of their because they are immunocompromised. Okay. Key points. Because this chapter has a lot of detail, I want you to make sure that you look at the key points for chapter 22, because you'll see some of them again. It really gives you the down and dirty on a lot of the chemotherapy stuff that I feel like is important for us to know without going into too much detail, and knowing the specific chemotherapy agents. So that ends our talk on chapter 22. Keep in mind that I'm more concerned that you know the care of the patient, nursing interventions for these patients, patient education for these patients, and know about chemotherapy, but do not worry about the different types of chemotherapy. If you become an oncology nurse, you'll learn all about that. And we'll go into breast cancer in a few minutes.